Rarely do we come across professionals who choose a field to excel in just on the premise of serving others and bringing a change in the quality of their lives. Dr. Robin Khosa is one such person who chose oncology as he was deeply touched by the apathy of those who suffered from it. Coming from a small village in Punjab, it has undoubtedly been a long journey to become one of the most coveted radio oncologists of the country. Come, let's meet him in person.
Viewers, there are two professions that I have always found are the most challenging for any individual. While every profession that an individual takes is important for his or his family's growth, a community's growth, the growth of a nation, and at large helping everybody, contributing every day, there are two professions which make an individual walk on the edge of a sword. And one of them that we are going to talk about is about being a doctor, because when you are a doctor, there is somebody on the other side of the table who is offering his own life in a plate to you that you have to take care of. And especially if you are a doctor of rare diseases, life-threatening diseases. Yes, our guest today is Dr. Robin Khosa, who's one of the most profound radio oncologists in the north of India, practicing from the Apollo Hospital today. Welcome, Dr. Robin. So amazing to have you with us. Such a complex field and such a complex science. And how do you handle that entire trauma of people coming and watching them slip away into darkness? Or, how do you inspire them to, think beyond cancer?
Yeah, it's a long journey. The journey started in my first decade. I was a small kid and very prone to infections and all. Every time you go to a doctor, he'll give you a pill, and I had a very, very tough time swallowing those pills, and my mother would just crush them, and the bitter taste of it, I would just say the next time to the doctor.
Yeah, every child gets disturbed because of that.
Just give me an injection. I just want to get okay. And but yeah, it was a little painful to begin with, but then I got used to it, and I never disliked getting an injection because they cured you quickly. And I was impressed by the doctor as well, his way of handling the patient, the cleanliness. My father would appreciate him so much. See how he cleans his hands and doesn't touch anything so that no infection transmits to you. That kept on happening.
And that too in the 1980s.
Yeah, very
right?
early. Very
when,
early.
We had very few facilities everywhere, not according to the kind of technology and, systems we have today in place.
Yeah, and then obviously the thought of becoming a doctor just crept on years and years and years, and eventually the preparation of this the entrance exam started.
And you topped in most of those entrance exams when we spoke.
Yeah, I got very good ranks in almost all the exams I gave, but yes, there was a lot of hard work and motivation from my professors, my mother, my father, who would just get up at night at 1 o'clock just to see if I'm studying. If I'm just slept, then he'll just switch off those lights and won't disturb me.
Why radio oncology? How did you get into radio oncology?
Yes, MBBS course only had the routine conventional branches which we all know, the medicine, the peds, the surgery and all. But it's only after I completed my MBBS, did my house job, I went into the oncology ward, and I had my duty there for approximately 4 months. And the whole
that actually, put you into a tumult of kind of emotions over there when you got in touch, because all you wanted to do was study for MS, and you took a house job for that, and you decided that you would get into that, and you actually landed up into a house job in the oncology ward. And wahan pe you were struck by a range of emotions looking at, because the category of patients is entirely different. I'm not there for a kidney stone or a gallbladder stone or those kind of things. I'm there because I want to live. So that started it off. What about the image guided radiation that you were talking about, for which you were awarded, you presented a scientific paper. What was that all about in the year 2009?
When I completed my post-graduation from a government institute and I shifted to a private sector, the spectrum of patients altogether changed. Patients were much more aware. They came to us with the much earlier stages of the disease, and one of them was prostate cancers. But the problem with prostate cancers, they are at such a location in your body. When you go and treat them with radiation, you actually end up causing lots and lots of toxicities. In these days, the technology was evolving very rapidly in our branch. It's lots and lots of computer-driven things, lots and lots of imaging. So what we used is inserted some gold seeds and tracked the motion of the prostate while patient is undergoing radiation therapy. That actually we got the Young Doctors Award for that.
See, that's what creativity lies in every profession. It is not just about being an artist, a musician, a designer, or a singer. Creativity is in every every inch of what you do, in the kind, and that is what also how you in 2017 you won an award for presenting a paper in the India Cancer Congress. It's only once in 4 years. What was that all about?
Yeah, that was quite a bit of innovation, and I don't think so anybody has done in India, or very few literature in the entire world. There was a patient who came to us with an inoperable tumor in the sacrum. Sacrum is a bone on which you sit actually. So if the surgeon goes for resecting that bone, he actually, the quality of life is no.
Yeah, the patient won't be able to sit any further.
Yeah. So our challenge was to treat this patient with radiation therapy, but the conventional radiation is not going to help this patient. So a very newer technology of radiation called the stereotactic radiation, where a very high dose of radiation is given in say 1 or 3 sittings. But the challenge with that is not treating the tumor, but sparing the normal organs, and your rectum is just sticking to this sacrum. So we artificially instilled normal saline to it and created a separation between the two structures. And
you had just a window of 4 to 7 minutes, because saline would get absorbed by the body, and in those 7 minutes you had to do the radiotherapy and give it the maximum push, whatever you could.
Exactly.
And what about that case that you told me about, a 28-day baby that you cured? I mean, they can't even sit in a certain position.
Yeah, I know. Yeah, that baby was from Uzbekistan and came to India because she wasn't able to breathe. The baby had neuroblastoma with a hepatic manifestation. The liver actually grows very big and hampers the breathing of the child. So few medications were tried, but they didn't help, and finally we were asked to intervene. The best thing was just 2 sessions of radiation, and so many blessings the patient's parents gave us.
This must be so emotionally traumatic also for you, right? Because जिनकी आप जान बचाते हैं, because cancer may people slip away, but I think saving that one life is what inspires you, that hey, maybe I can save another, right, viewers? And so this is what the entire motivation you're talking about, saving another life, motivated you to come up with a new kind of a system where you are actually curing for breast cancer, left-sided breast cancer, with imaging and something with your team, of course.
Yeah, it's a team effort. It's not my solitary effort. My mentor, who has guided me to devise a way,
Dr. Sapna
Nangia, she has guided us to devise a way how we can help these patients, because in the long run they should not have too many toxicities.
Yeah, breast cancer is on the rise, people, and Dr. Robin Khosa, guided by his mentor, of course, they all are coming up with this amazing technology on how to go with radiotherapy when breast cancer is right on the left breast, that is on the heart.
So the heart is just below your left chest, and we have to devise a way to spare your heart, and this DIBH is the technology, and it's now internationally accepted that this is the best way to treat the left breast cancer.
It's such great laurels Dr. Robin and his mentor are bringing to the country, because now this is being done in India as in the West, and there are not many places where this can be done. So Dr. Robin Khosa is a go-to man for you. If you could leave our viewers with something that has inspired you all your life, and what makes you keep going on and on amidst these traumatic conditions?
So something I heard in my early days, every person, every citizen in this country is a flag bearer, and your collective effort of each and every makes the difference to the nation. So neither a doctor, neither a teacher, neither an army person by itself make the nation. It's the collective effort of the entire society which will make our nation.
That is such a beautiful thought, viewers. You know, you don't need to be a doctor to save someone's life or a soldier to save someone's life. You could be a brilliant architect who makes buildings that helps people live, come up with structures that could be used in disaster management, helping humanity, helping the nation grow. Build the infrastructure in your own special way by giving your own best to it, right? Thank you so much, Dr. Robin Khosa. For such a humble leader like you, we would like to give you a gift by our gift sponsor called All My Craft, who won the Craft-Based Artisan Award under Atmanirbhar Bharat. They're doing a fabulous job over there. Also our travel partner, Velocity Car Renters, do check them out. So thank you, Hotel Crown Plaza, for being the venue partner of this fabulous show, where at least I get to hear so many amazing real life stories. And so stay tuned with us, viewers, because our next guest is just a 22-year-old gentleman who, with his extreme focus and his brilliant vision, wants to add something new to the nation. Thank you. Stay with us as we'll be right back.